An Auckland GP has written to the Health Minister and Director General urgently requesting booster shots be authorised for frontline health workers.
It comes amid concern that vaccines going in the bin at the end of the day could be put in the arms of those whose immunity is waning. Investigations reporter Michael Morra has this story.
Thousands of empty vials, the waste bins representing a month's worth of injections, but it's not hard to find the odd one that's unused. Doses are being wasted at GP clinics too when people don't turn up for appointments.
We've got a bit of a silly situation where there is vaccine available. It's being thrown out in practices every day, and yet there are people in practices who could very well benefit from having those doses.
Look, I've had several practices contact me about that issue and whether they can give the booster at this point to staff.
Most GPs got their second dose about 6 months ago. International research shows immune protection from the Pfizer vaccine drops from 88 to 47% over that time period. The government's indicated boosters will be dished out before Christmas. Dr Roy Nill's written to ministers, urging them not to wait.
We should have that right now. We don't see why we should wait. COVID numbers are going up. We will be coming in contact with more COVID. We need those boosters now.
ProCare, the country's largest group of general practices, which services around 800,000 people in Auckland, say many frontline health workers want the booster shot, especially older doctors and nurses who got their second dose earlier this year. The company says it wants clarity from the ministry so it can plan its rollout. ProCare Chief Executive Bindi Norwell told Newshub this is especially important as the Christmas break is just 8 weeks away now. At this vaccine clinic in Henderson, staff say they do their best to get any spare doses into arms.
So we'll run into the car park across the road, see if there's anyone out there who hasn't been vaccinated and invite them in.
There is some wastage, very minimal wastage, because we're counting constantly what's coming through the door.
Both of them say there's a lot of interest among staff in getting that third dose. The ministry says MedSafe's assessing an application from Pfizer to vary the dosing instructions to include the use of a booster dose. It says only 0.29% of vaccines are wasted. Brian Betty says having 2 doses, even if it was months ago, will still provide protection.
The vaccine still protects you against serious disease and death. The thing that changes is a slight increase in transmissibility.
Getting COVID on the job is the last thing doctors want, and they hope the booster is an early Christmas present rather than a late one. Michael Morra, Newshub.